Does taking a deep breath sometimes feel like more effort than it used to? Perhaps you find yourself getting winded more easily. Maybe climbing a flight of stairs leaves you needing to pause. Or perhaps a persistent cough has become an unwelcome companion in your daily life. These experiences, these subtle or not so subtle changes in how your body feels and functions, particularly concerning your breathing, can be unsettling. You might brush them off, initially thinking, well, I'm just getting older, or perhaps attributing them to being a bit out of shape. But sometimes, these signs point towards something more specific, a condition that affects millions of people, particularly as we age, called chronic obstructive pulmonary disease, or COPD. Hearing a term like COPD can sound daunting, even a little frightening. It's a medical label, and medical labels often come with a weight of uncertainty and concern. What does it really mean? How will it affect my life? What can be done about it? These are perfectly natural questions that likely echo the thoughts of many others who have found themselves facing this diagnosis or suspecting they might have the condition. It's important to know, right from the start, that you are certainly not alone in this. COPD is one of the most common lung conditions worldwide, and its prevalence does tend to increase as we get older. This is often linked to the cumulative effects of exposure to things that can irritate the lungs over many years, with cigarette smoking being the most significant factor for many, though certainly not the only one. Long-term exposure to air pollution, dust, or chemical fumes in certain work environments, and in some rarer cases, a genetic predisposition, can also play a role. So, what exactly is COPD? Let's break down the name itself. Chronic simply means that it's a long-term condition, one that develops gradually and typically persists over time. It's not like a cold or flu that comes and goes relatively quickly. Obstructive refers to the core issue. There's a limitation, a blockage of sorts, in the airflow out of your lungs. This makes it harder to exhale fully, which can, in turn, make it feel harder to get the next breath in. Pulmonary just means it relates to the lungs, and disease indicates it's a health condition affecting the normal function of the body. In essence, COPD is an umbrella term used to describe progressive lung diseases, including emphysema and chronic bronchitis. Emphysema primarily involves damage to the tiny air sacs, alveoli, in the lungs, making them less elastic and efficient at transferring oxygen. Chronic bronchitis involves long-term inflammation and narrowing of the airways, bronchial tubes, often accompanied by increased mucus production and that persistent cough. Many people with COPD experience features of both conditions. Understanding this basic definition is the first step, but acknowledging the experience of living with COPD, or the suspicion of it, is perhaps even more crucial. It's completely understandable if you've been feeling anxious or worried. The sensation of breathlessness, medically known as dyspnea, can be genuinely frightening. It can feel like you just can't get enough air, triggering a sense of panic or vulnerability. This physical sensation can easily spill over into emotional distress. You might find yourself feeling frustrated by limitations you didn't have before. Maybe activities you once enjoyed, like gardening, taking long walks, playing with grandchildren, or even simple household chores, now seem exhausting or challenging. This can lead to feelings of loss of energy, loss of ability, perhaps even a loss of the sense of self you were accustomed to. It's also common to feel a degree of isolation. When breathlessness makes it difficult to keep up, you might start avoiding social gatherings or outings. Explaining why you need to rest frequently or why you can't join in certain activities can feel awkward or burdensome, leading some to withdraw. There might be embarrassment associated with a chronic cough or the need to use supplemental oxygen, if it comes to that. Concerns about the future are also natural. Will it get worse? How will I cope? Will I become dependent on others? These worries can weigh heavily on your mind, affecting your mood and overall outlook. Please know that these feelings, the fear, the frustration, the sadness, the anxiety, the uncertainty, are valid. They are shared experiences for many people navigating life with a chronic respiratory condition. Recognizing and accepting these emotions is an important part of the journey. But here is the crucial message, the one I want you to hold on to. While COPD is indeed a chronic condition and currently has no cure, it is absolutely manageable. A diagnosis of COPD is not an endpoint. Rather, it's a turning point, a point where you can begin to take proactive steps to understand your condition, work closely with your healthcare team, and implement strategies to improve your breathing, maintain your quality of life, and feel more in control. There is so much that can be done. Medical treatments have advanced significantly, offering ways to open airways, reduce inflammation, and manage symptoms effectively. Lifestyle adjustments, particularly stopping smoking if you currently do, engaging in appropriate physical activity through pulmonary rehabilitation programs, and learning breathing techniques can make a profound difference. Understanding how to manage flare-ups, recognizing their early signs, and having a plan in place can prevent complications and hospitalizations. Equally important is tending to your emotional well-being, finding support systems, and maintaining a hopeful and positive mindset. This journey of understanding and managing COPD is what we'll be exploring together. In this first chapter, we've started by acknowledging the condition, its prevalence, and the very real emotional and physical impact it can have. We've touched upon what COPD means in simple terms. Think of this as laying the groundwork, creating a shared understanding of the landscape we're navigating. In the next chapter, we will delve much deeper into the practical aspects, the specific strategies, treatments, and lifestyle choices that form the core of effective COPD management. We'll explore things like medication options, the vital role of pulmonary rehabilitation, specific breathing exercises you can learn, nutritional considerations, and the importance of vaccinations. We'll break down these elements in detail, aiming to provide you with clear, actionable information. Then, in our final chapter, we'll focus on pulling everything together, reinforcing the key takeaways, discussing how to build a strong partnership with your healthcare providers, finding ongoing support, and cultivating the resilience and positive outlook that are so vital for living well day by day, even with a chronic condition like COPD. The goal throughout is empowerment, providing you with the knowledge and understanding you need to navigate this path with confidence and hope, focusing not just on managing a disease, but on living your life as fully as possible. Having acknowledged the reality of COPD and the understandable concerns that come with it, let's now turn our focus towards the truly hopeful part, the proactive steps you can take to manage the condition effectively. Think of this chapter as opening up a toolkit, filled with strategies and resources designed to help you breathe easier, stay more active, and maintain control over your health and well-being. Managing COPD is very much a partnership between you and your healthcare team, and the more informed you are, the more effectively you can participate in your own care. Perhaps the single most impactful step, if it applies to you, revolves around smoking. If you are currently smoking, stopping is, without question, the most crucial action you can take for your lung health. I understand completely that quitting smoking, especially if it's been a lifelong habit, is incredibly difficult. Nicotine is highly addictive, and the habit itself becomes deeply ingrained in daily routines. But the reality is stark. Continued smoking is like pouring fuel on the fire of COPD. It accelerates the damage to your airways and lung tissue, leading to a faster decline in lung function and more severe symptoms. Stopping smoking is the only intervention proven to significantly slow down the progression of the disease. When you stop, the ongoing irritation and inflammation in your airways begin to lessen. While it won't reverse the damage already done, it prevents further rapid deterioration. Many people find that even within weeks or months of quitting, their cough lessens, they produce less mucus, and their breathing feels somewhat easier. The long-term benefits are even more profound, including a reduced risk of exacerbations, those sudden worsening periods we'll discuss later, fewer hospital visits, and a lower risk of other smoking-related diseases like heart disease and lung cancer. Please know that you don't have to face quitting alone. There's a wealth of support available. Talk to your doctor about nicotine replacement therapy, patches, gum, lozenges, prescription medications like varenicline or bupropion that can reduce cravings and withdrawal symptoms, counseling services, and support groups. Many people find combining medication with behavioral support offers the best chance of success. It might take several attempts, and that's okay. Every attempt is a step in the right direction. Imagine the relief, the sense of accomplishment, and the tangible improvement in your breathing that could come from finally breaking free from tobacco. Beyond smoking cessation, medications form a cornerstone of COPD management. It's important to understand that these medications don't cure COPD, but they are incredibly effective at controlling symptoms, reducing the frequency and severity of flare-ups, and improving your ability to stay active. The most common and important types are bronchodilators, usually delivered via inhalers. Think of these as medicines that help to open up your airways. They work by relaxing the tight muscles around the bronchial tubes, widening the passage for air to flow more freely in and out. There are two main types: short-acting bronchodilators, often called rescue or reliever inhalers, like albuterol, which work quickly and are used as needed for immediate relief of breathlessness, and long-acting bronchodilators, like tiotropium, salmeterol, formoterol, often called maintenance or controller inhalers, which are taken on a regular schedule, typically once or twice a day, to provide ongoing symptom control and prevent breathlessness. Many people benefit from using a long-acting inhaler daily to keep their airways consistently open, and having a short-acting one available for times when symptoms flare up unexpectedly. For some individuals, particularly those with more severe COPD or frequent exacerbations, inhaled corticosteroids may also be prescribed. These medications work by reducing inflammation within the airways. Inflammation contributes to swelling and mucus production, further narrowing the passages. Corticosteroids help to calm this inflammation down. Often, they are combined with a long-acting bronchodilator in a single inhaler for convenience and a synergistic effect, tackling both muscle tightness and inflammation simultaneously. It's crucial to use your inhalers exactly as prescribed by your doctor. This includes using them regularly, even when you're feeling well, if they are maintenance medications. Equally vital is using the correct technique. If you don't use your inhaler properly, the medication may end up in your mouth or throat instead of reaching deep into your lungs where it's needed. Ask your doctor, nurse, or pharmacist to demonstrate the correct technique for your specific device and practice it under their supervision. Using a spacer device with certain types of inhalers, metered dose inhalers, can make it easier to get the full dose into your lungs. Don't hesitate to ask for a refresher if you're unsure. If you use an inhaled corticosteroid, Remember to rinse your mouth with water and spit it out after each use to reduce the risk of side effects like thrush, a fungal infection in the mouth, or hoarseness. Other medications might be considered depending on your specific situation, such as pills to reduce inflammation like roflumilast, antibiotics during infections, or medications to help thin mucus. The key is working with your doctor to find the right medication regimen tailored to your individual needs and severity of COPD. Just as important as medication, and sometimes even more impactful on daily function, is pulmonary rehabilitation. Please don't dismiss this as just exercise for people with lung problems. It is so much more than that. Pulmonary rehabilitation is a structured, comprehensive program designed specifically for people with chronic lung conditions. It typically involves a team of healthcare professionals, including respiratory therapists, physical therapists, nurses, and dietitians. A core component is supervised exercise training. This might sound counterintuitive, exercise when you get breathless? But the right kind of exercise, done safely and progressively, can work wonders. It helps strengthen not only your arm and leg muscles, but also your breathing muscles, making them more efficient. It improves your endurance, meaning you can do more before feeling winded. It reduces the sensation of breathlessness for a given level of activity, increases your energy levels, and significantly boosts your overall quality of life. Programs usually include aerobic exercise like walking on a treadmill or stationary cycling, as well as strength training. The key is that it's tailored to your current abilities and gradually increased as you get fitter, all under the watchful eye of professionals who understand COPD. Many participants start out feeling apprehensive, worried about becoming too breathless. But the therapists are experts at managing this, teaching you how to pace yourself and use breathing techniques during activity. Beyond exercise, pulmonary rehab provides invaluable education about COPD itself, understanding how your lungs work, how medications help, how to use oxygen therapy correctly if prescribed, and importantly, how to recognize and manage those flare-ups or exacerbations. A huge benefit comes from learning specific breathing techniques. Two of the most helpful are pursed lip breathing and diaphragmatic or belly breathing. Pursed lip breathing involves inhaling slowly through your nose and exhaling even more slowly through gently pursed lips, like you're going to whistle softly. This simple technique helps keep your airways open longer during exhalation, allowing you to empty your lungs more completely and reducing that feeling of trapped air. It can be incredibly calming and effective when you feel short of breath. Diaphragmatic breathing encourages you to use your main breathing muscle, the diaphragm, more effectively. By placing one hand on your chest and the other on your belly, you learn to breathe in so that your belly rises while your chest stays relatively still, and exhale slowly. This type of breathing is more efficient, uses less energy, and helps pull more air into the lower parts of your lungs. Learning and practicing these techniques regularly can make a real difference in managing breathlessness during daily activities. Pulmonary rehab also often includes nutritional counseling and emotional support, recognizing the holistic nature of managing a chronic condition. People often find great camaraderie and reduced feelings of isolation by connecting with others facing similar challenges. If your doctor recommends pulmonary rehabilitation, I strongly encourage you to participate. Many people describe it as life-changing, giving them back a level of activity and confidence they thought they had lost. Now, let's talk about those flare-ups, medically known as exacerbations. These are periods, often lasting days or even weeks, when your usual COPD symptoms suddenly worsen significantly. You might become much more breathless than usual, your cough might increase or become more productive, and the mucus you cough up might change color, e.g., yellow or green, or thickness. Fatigue often increases too. These exacerbations are frequently triggered by respiratory infections, like colds, flu, or pneumonia, or sometimes by exposure to air pollution or other lung irritants. They can be serious, sometimes requiring hospitalization, and they can lead to a permanent decline in lung function. Therefore, preventing them and managing them promptly is crucial. Prevention involves several key strategies: getting your annual flu shot, staying up to date with pneumococcal vaccinations, which protect against certain types of pneumonia, and receiving COVID-19 vaccines and boosters as recommended. Practicing good hand hygiene, washing hands frequently, and avoiding close contact with people who have colds or the flu are also important. Paying attention to air quality alerts and minimizing exposure to smoke, dust, and fumes can help too. Equally important is recognizing the early warning signs of an exacerbation. Don't ignore worsening symptoms. Work with your doctor to create a personalized COPD action plan. This plan will outline what your usual symptoms are, what signs indicate a flare-up is starting, and what specific steps you should take. This might include increasing the use of your short-acting rescue inhaler, starting a course of antibiotics or oral corticosteroids that your doctor has prescribed for you to keep on hand for such occasions, and, critically, knowing when your symptoms warrant contacting your doctor immediately or seeking emergency care, e.g., severe breathlessness unrelieved by rescue inhalers, confusion, drowsiness, chest pain. Having this plan provides clarity and empowers you to act quickly, which can often prevent a mild flare-up from becoming a severe one. For some individuals with COPD, particularly as the condition progresses, blood oxygen levels may become consistently low. This is called hypoxemia. Your doctor can check for this using simple tests like pulse oximetry, a small clip on your finger, or sometimes an arterial blood gas test. If your oxygen levels are found to be persistently low, your doctor may prescribe supplemental oxygen therapy. It's vital to understand that oxygen therapy isn't just about making you feel less breathless, though it can help with that. Its primary purpose is to ensure that your body's vital organs, including your heart and brain, receive the oxygen they need to function properly. Chronic low oxygen puts a significant strain on the heart and can lead to serious complications over time. Using supplemental oxygen as prescribed can actually improve survival, reduce hospitalizations, enhance sleep quality, improve mood and mental alertness, and increase your ability to exercise. Oxygen can be supplied through stationary concentrators, machines that extract oxygen from the air for use at home, or via portable tanks or smaller portable concentrators for use when out and about. It's typically delivered through thin tubes placed in the nostrils, a nasal cannula, or sometimes a mask. It's essential to use the oxygen exactly as prescribed by your doctor, including the correct flow rate, liters per minute, and the recommended number of hours per day, often including during sleep or exercise. And please, remember the critical safety rule: absolutely no smoking or open flames near oxygen, as it is highly flammable. While some people may feel self-conscious about using oxygen, try to view it as a vital medical treatment, a tool that enables you to live a more active and healthier life despite your COPD. Finally, let's not overlook the importance of nutrition and hydration. Simply breathing requires more energy when you have COPD, sometimes burning significantly more calories than someone without the condition. At the same time, symptoms like breathlessness, fatigue, or feeling overly full quickly can make eating difficult. This combination means that malnutrition is surprisingly common in people with COPD, and being underweight can weaken your muscles, including those essential for breathing. On the other hand, being significantly overweight can also increase breathlessness by making it harder for your lungs and diaphragm to expand. finding a healthy balance is key. If you find large meals make you feel too full and breathless, try eating smaller, more frequent meals and snacks throughout the day. Focus on nutrient-dense foods, ensuring you get enough protein to help maintain muscle strength. Staying well hydrated by drinking plenty of fluids, water is best, is also important, as it can help keep mucus thinner and easier to cough up. If you have related heart issues, your doctor might advise limiting your salt intake to help manage fluid retention. If you're struggling with maintaining a healthy weight or ensuring adequate nutrition, ask your doctor for a referral to a registered dietitian who can provide personalized advice. As you can see, managing COPD involves a multifaceted approach. It's not just about one thing. It's about combining these different strategies: smoking cessation, appropriate medication use, pulmonary rehabilitation, managing exacerbations, using oxygen if needed, and paying attention to nutrition to create a comprehensive plan tailored to you. Each element plays a vital role in helping you gain better control over your symptoms and live more comfortably and actively. In our next chapter, we'll bring all these pieces together, focusing on how to build a strong relationship with your healthcare team, the importance of ongoing support, and nurturing the resilient mindset that will empower you to navigate life with COPD with confidence and optimism. We've traveled quite a path together in our discussion about understanding and managing chronic obstructive pulmonary disease. We began by acknowledging what COPD is, addressing the very natural feelings of concern, anxiety, and uncertainty that can arise with such a diagnosis or even the suspicion of it. We established that while COPD is indeed a chronic long-term condition, it is far from a sentence to inactivity or despair. The core message, the thread weaving through our entire conversation, has been one of hope, action, and empowerment. In our second chapter, we delved deep into the practical toolkit available to you, the concrete strategies and treatments that form the foundation of effective COPD management. Now, in this final chapter, let's bring all those threads together, reaffirming the key takeaways, considering the broader perspective of living well with COPD, and reinforcing the message that you possess a significant degree of control over your health and quality of life. Let's revisit those crucial pillars of management we explored. Remember, if you smoke, the single most powerful action you can take to influence the course of your COPD is to stop. We acknowledged how challenging this can be, but the benefits, slowing disease progression, reducing symptoms, preventing flare-ups, are immense and undeniable. Please, reach out for help. Numerous resources, from medications to counseling, exist to support you on this journey. Every day smoke-free is a victory for your lungs. Then we discussed medications, primarily the bronchodilators delivered through inhalers. These are your allies in keeping airways open and reducing breathlessness. We differentiated between the short-acting rescue inhalers for quick relief and the long-acting maintenance inhalers for ongoing control, sometimes combined with inhaled corticosteroids to manage underlying inflammation. The keys here are consistency, using maintenance inhalers as prescribed even when feeling well, and correct technique, ensuring the medicine reaches deep into your lungs where it's needed most. Don't ever hesitate to ask your doctor, nurse, or pharmacist to review your inhaler technique. It truly makes a difference. We spent considerable time on pulmonary rehabilitation, and for good reason. This isn't merely exercise, it's a comprehensive program that can genuinely transform your experience with COPD. Through supervised exercise tailored to your abilities, you can strengthen your breathing muscles, improve endurance, reduce breathlessness during activity, and regain confidence. Just as importantly, Pulmonary rehab equips you with knowledge about your condition, your medications, and crucially, those invaluable breathing techniques like pursed lip breathing and diaphragmatic breathing. Mastering these techniques gives you a practical tool to manage breathlessness in the moment, calming both your body and mind. The educational and supportive environment of pulmonary rehab, often shared with others facing similar challenges, combats isolation and fosters a sense of community. If this program is offered to you, consider it a vital investment in your well-being. Managing exacerbations, those sudden worsening periods, is another critical piece of the puzzle. Prevention is paramount. Getting your vaccinations, flu, pneumonia, COVID-19, practicing good hygiene, and avoiding known triggers like smoke or infections when possible. Equally vital is having that personalized COPD action plan developed with your doctor. Knowing the early warning signs of a flare-up and knowing exactly what steps to take, when to increase your rescue inhaler, when to start prescribed emergency medications like antibiotics or steroids, and when to seek urgent medical attention, empowers you to act swiftly and potentially avoid a serious decline or hospitalization. Don't ignore worsening symptoms. Early intervention is key. For those whose condition progresses to the point of low blood oxygen levels, we discussed supplemental oxygen therapy. Remember, its primary role is to protect your vital organs by ensuring they get enough oxygen, thereby improving long-term health, survival, and often daily function and alertness. Using it exactly as prescribed, including the flow rate and duration, and adhering strictly to safety precautions, no smoking, is essential. View it not as a burden, but as a necessary medical treatment that supports a fuller life. Finally, we touched upon the importance of nutrition and hydration. Fueling your body adequately to meet the increased energy demands of breathing, maintaining muscle strength, and keeping mucus manageable, perhaps through smaller, more frequent, nutrient-rich meals. Summarizing these strategies is helpful, but living well with COPD goes beyond just ticking boxes on a management plan. It involves a shift in perspective, a cultivation of resilience, and a commitment to self-care in the broadest sense. Accepting that COPD is now part of your life story is a significant step. This doesn't mean giving in or giving up. It means acknowledging the reality so you can work with it, not constantly fight against it in a way that drains your energy. It might mean adapting how you do certain things, perhaps pacing yourself more, breaking down larger tasks into smaller steps, or finding modified ways to enjoy hobbies you love. It's about focusing on what you can do, celebrating small victories, and giving yourself grace on days when symptoms are more challenging. Self-compassion is vital. There will be good days and not so good days. It's okay to rest when you need to, without guilt. Pushing yourself too hard when your body is signaling distress can sometimes lead to setbacks. Learning to listen to your body and respond kindly is a skill that develops over time. It's also important to acknowledge the emotional and psychological impact of living with a chronic illness. Feelings of frustration, anxiety, or low mood are not uncommon when dealing with breathlessness and physical limitations. These feelings are valid, but they don't have to dominate your life. Connecting with others, whether through support groups, in person or online, or simply talking openly with family and friends, can make a huge difference. Sharing experiences and realizing you're not alone can be incredibly validating and comforting. If feelings of anxiety or depression persist or significantly impact your daily life, please talk to your doctor. Just as there are treatments for the physical aspects of COPD, there is help available for the emotional challenges too, including counseling or medication if appropriate. Tending to your mental well-being is just as crucial as tending to your physical health. Central to navigating this journey successfully is building a strong, collaborative partnership with your healthcare team. Your doctor, respiratory therapist, nurses, and potentially specialists like pulmonologists or dietitians are your resources. Be an active participant in your care. Prepare for appointments by writing down questions or concerns. Be honest about your symptoms, how you're feeling, and any difficulties you're having with your treatment plan. Report any changes, especially signs of a potential exacerbation, promptly. The more information your team has, the better they can tailor your care to your specific needs. See them not just as experts giving instructions, but as partners working alongside you towards the shared goal of optimizing your health and well-being. Ultimately, managing COPD is about taking control where you can. You control the decision to stop smoking. You control whether you take your medications correctly. You control your participation in pulmonary rehabilitation. You control learning and practicing breathing techniques. You control monitoring your symptoms and following your action plan. You control seeking support and communicating with your healthcare team. While you cannot control the underlying disease process entirely, you have immense influence over how you manage it and how it impacts your life. This sense of agency is incredibly empowering. Think of each breath. It's fundamental to life. While COPD may affect the ease of breathing, it doesn't diminish the value of each breath or the value of your life. By understanding your condition, embracing the available management strategies, nurturing a positive and resilient mindset, and working closely with your support network and healthcare providers, you can continue to find joy, meaning, and purpose in your days. Living with COPD presents challenges, undoubtedly, but it does not preclude living well. Focus on the steps you can take, celebrate your progress, be kind to yourself, and know that proactive management can make a profound difference. Your journey is unique, but you are not walking it alone, and there is every reason to face the future with hope and determination. Take charge of your breath, take charge of your health, and continue to live your life as fully as possible.